Hi, I'm Dr. Sandra Premkumar. Today let's talk about acne, which is also known as pimples. Now acne is a very common problem and all of us must have suffered from it at least at some point. Now acne or bad acne can really affect your personality and your self-esteem. Even though it's not a life-threatening condition, it can be really frustrating and affect your quality of life. And because of that, it is something that needs to be treated and taken seriously. As a dermatologist, I can help you manage your acne and make you feel more confident about yourself and make sure we minimize acne scarring as much as possible. What is acne? Now, acne is a skin condition in which there is a chronic inflammation of the hair follicle. In medical terms, it's known as acne vulgaris. Now, acne most commonly develops on your face, but it can occur over any other part of your body, like your chest, on your back, on your shoulders, and even on your scalp. The most common age to develop acne is during puberty or during adolescence, when your oil glands they become more active because of the hormonal change. Now, acne occurs when your pore of your skin gets blocked. Now, the pore of your skin is an opening to a follicle which contains a hair and an oil gland, which is also known as a sebaceous gland. Now, this sebaceous gland secretes an oily substance known as sebum, which is a natural moisturizer of your skin which lubricates it and keeps it soft and supple. Now, trouble begins when excess of sebum and dead skin cells they build up and they clog the pores, and an added infection by a bacteria known as Propionibacterium acnes or P. acnes can further make it more inflamed. All of these contribute and they present as acne, which is seen as these tiny red bumps on your skin. Now, the primary lesion in acne is known as comedones. It's also known as the blackheads and the whiteheads. Now, blackhead is also known as an open comedone in which the pore of your skin, which contains keratin or your skin cells, they get exposed to oxygen and they turn dark. Whereas whitehead is also known as a closed comedone. They lie beneath the surface of the skin and they're not exposed to air. There are certain other lesions which are seen in acne are the papules, the pustules, the cysts and the nodules. Now, the papule are these red raised lesions which are seen on your skin. The pustule is similar to a papule but they contain pus in them. Now, cysts and nodules are these large lumps which are seen beneath the skin which contains pus and it can be painful. Now, whether if you have a papule or a nodule or a cyst or blackheads or whitehead, the most important thing is that do not pick at them and do not touch your face. I know it's hard not to do so, but that can lead to acne scarring. Now, let's talk about the causes of acne. First is genetics. If one of your parents or both your parents had acne, then you might develop the same thing. Second, it can be related to hormones. Hormonal fluctuations can really trigger your acne. Now, this is why teenagers have more acne compared to other age group. Sometimes women in their late 20s can develop acne, especially cystic painful acne along your jawline and on your chin. Now, this can be related to PCOS or polycystic ovarian syndrome. Third, menstruation can also trigger acne. You might develop a sudden outbreak of acne just a week before your periods. Fourth, it can be related to stress. Like teenagers can develop acne just before your exams, and in adults it can be seen just before an important event or a meeting. Excessive face washing and scrubbing of your face can also lead to acne. So if you have severe acne, you need to limit washing your face at least 2 or 3 times in a day. Now, there's a condition known as pomade acne. This is most commonly seen in teenagers, which presents as blackheads and whiteheads on the forehead or the sides of the face. This is mainly because of the hair falling on the forehead. The oil or the gel products in the hair, it blocks the pore and it causes acne. Now, the only way to prevent this is to avoid sleeping with gel products and oil in your hair. Now, sunlight and heat exposure as well as sweating can also lead to acne. Sweat can actually block the pores and it can lead to acne. Certain medications can also trigger acne, like steroids and certain antipsychotic medications. Now, oil-based creams or oil-based cosmetics can also trigger acne, and certain protein supplements can also trigger acne. Last but not the least, let's talk about the diet in acne. Even though it's a controversial topic, recent studies have shown that dairy products or milk products can increase a hormone known as IGF-1, which is also known as insulin-like growth factor. This can increase the sebum levels and can trigger acne. Also, certain processed sugars and processed carbohydrates, which is seen in most of the junk food and sodas, can also increase acne. So if you have severe acne, you might need to limit the intake of these food and have a proper balanced diet. If you want to know about the treatment of acne, please see my next video. And please don't forget to like the video and subscribe to my channel. Thank you.